What's up, everybody? Welcome to the Luxury Health Podcast. We have a very special guest in the building. And before I say her name, she is very special because this is the first alumni of the greatest high school in the land that I've had on this podcast. From Southwest DeKalb High School, the one and only Panther, Dr. LaKendra McCullum. How's it going?
Pretty good.
As y'all can hear, I'm very excited because, like I said, I love Southwest DeKalb High School, loved everything it taught me, loved everything about it, loved connecting with people from the high school. So when I found out that Dr. LaKendra was a chiropractor, I definitely said I need to have her on this podcast so she can share her knowledge with my audience and with myself as well. So I just want you to really talk about the benefits of being a chiropractor and why we should get those practices, and just give us knowledge about what you know about being a chiropractor. So before we get into that, I really want you to share your story about how you became a chiropractor and how you wanted to help people in this way.
Okay. So first, I was LaKendra McCollum when I was at Southwest. Now it's Fulbright. Dr. Fulbright now. But I am a alumni of Southwest DeKalb, and for anybody who was there around the time I was there, they knew me as the Track Star. So I ran track there, and I was a cheerleader as well. So I was involved in, a lot of activities while I was there. I got a full track scholarship to Florida State, so I was in Tallahassee and was running track there. And I met a chiropractor who was a part of the sports medicine team. And initially I wanted to be a pediatrician. But as I saw him and, just kind of saw what he was doing, I approached him. I'm like, hey, what are you doing to people? It just looks like you working on their back or whatever. And he just explained what chiropractic was and why it was beneficial for athletes and even people who weren't athletes. So he invited me to my office and I fell in love with it. I liked the rapport that he had with his patients. If they said their shoulder hurt, he touched it. He figured out, what was going on. He told corny jokes. But I liked it. And I realized growing up, I wasn't really sick, so I never really went to the doctor. My only memories of going to the doctor was, hey, you okay? Stick your tongue out. Okay, let's get your height and weight. That's it. And there wasn't really a connection. And so I felt like chiropractic, there was more of a connection. And then learning more about how it was part of a holistic lifestyle, if you could avoid more invasive procedures, medications with all the side effects, surgery, it was just more on the natural side. So I felt like it went more with, the type of thing that I wanted to do. So.
Nice. So what I take away from that, first you went down to Florida State to be a pediatrician originally, and then you fell in love with being a chiropractor. So it seems like you wanted to work with the human body initially. Do you think that came from your love of sports? You ran track your entire life. How did you even get involved with wanting to work with the human body?
Yeah, so definitely sports had something to do with it. Just interested in how the body worked. My undergrad degree and my master's degree are both in exercise science, exercise physiology. So it's not just the anatomy and naming the structures, but knowing how it works. I was always interested in that. And so for a career, I wanted to pick something where I could work with the human body and just help people feel better. In my family, the women live a long time.
Okay.
On my mom and my dad's side, I got to grow up with my great-grandmothers. And so just thinking about health holistically, I knew I wanted to live a long time like my great-grandmothers, and they were in good health, And so then to see a contrast of people who were 60 or 70 confined to a wheelchair, couldn't do for themselves, I just knew that I wanted to live a healthy lifestyle, not just for me, but I wanted to create that type of lifestyle for other people. So healthcare was just a natural draw for me.
Yeah. So that's awesome to hear because I love talking with former athletes because I was a swimmer myself, so I know about the daily grind of going to practice and the wear and tear on your body when you do it from, a young age of 7 to 8 years old all the way through high school and through college. So I understand about the daily grind it has on the body. But when people typically hear about chiropractic procedures, I know myself, I automatically think it's for athletes. It's not for the everyday person. But when you sit back and think about it, it possibly could be for the everyday person, because even for the office worker who sits down at their office, look at a computer hunched over, I'm assuming they could benefit from chiropractic services as well. So talk a little bit about the type of patients that you typically treat. Is it just athletes, or is it everyday working people as well?
So that's a good question. And actually, more times than not, people associate chiropractic with car accidents, especially in an area like Atlanta. You have all the commercials, turn that red into a big man check. So it's usually athletes, or it's, I haven't been in a car accident, or, my back doesn't hurt. People tend to confine chiropractic to that. But with the athlete, it's interesting because I look at everybody as an athlete. So even if you don't compete, like you said, whatever job or whatever your career choice is, there's a certain level of physical exertion that goes into that. So the worker, yes, even though they're sitting, and you think that's relaxing, that's actually taxing, certain muscles and joints in your body. So, it's a sedentary type of athlete. Yeah. But even like postal workers, people who work at warehouses. Yeah. So everybody is an athlete in some sense, and just getting their background on the type of work that they do, even a stay-at-home mom. I mean, carrying a 20, 30-pound kid, doing laundry, multitasking. Everybody in their own right is an athlete per se, but chiropractic is for everyone. And I have people that come into my office and they're like, well, what's the oldest person you treat? What's the youngest person, And I'm like, I can treat anybody with a spine. Chiropractic is on the conservative end, so it's safe for everybody. The youngest person that I've treated was a few days old. The oldest person I've treated, I believe, was maybe 86 years old. So there aren't any restrictions. Now, of course, just like in the medical field, there are different specialties. Some people have pediatric chiropractic practices where they only see children. There are some people that focus on prenatal, so they only, they focus on pregnant women, families. Some people only do the car accident, the personal injury type practices. So it's so many different specialties within chiropractic. And most people, like me, are general chiropractors. I can see everybody, but obviously there's a certain type of patient that gravitates to my office. Of course, I do see a lot of athletes. When I was pregnant, I started seeing a lot of pregnant women. So I just think whatever I had going on, that's what gravitated towards me.
Nice. And I'm glad you mentioned you think that everyone's an athlete, and then you mentioned specifically the stay-at-home mom who carries a child, because my wife, the past couple of weeks, has been complaining about her shoulder, because she's been picking up my 3-month-old son, from the crib or walking around the house with him. And I suggested, we typically get massages at least once a month, but I suggested that maybe she needed to look into seeing a chiropractor. And I'll talk to you more about that later. But I'm glad you mentioned that, because that kind of validates, maybe she do need to go see a chiropractor. So let's talk about the benefits of chiropractic services. What are some of the benefits? If I was in a car accident and, my head jerked back and forth, I got whiplash, what would be some of the benefits that a chiropractic service could do for me? And then also, let's make it more relatable to the everyday person, everyday postal worker, as you mentioned, the office worker who sits down and types on their computer a couple of hours a day. What are the benefits of them coming to get chiropractic services?
That's a good question. So the main thing that a chiropractor does that sets them apart from any other type of healthcare practitioner, we do what's called an adjustment. Okay. And my friends and family members call it getting their neck cracked, getting their back. And I'm always correcting them. But so the technical term is an adjustment. So that is the main treatment that chiropractors do. Yeah. And then there are other ancillary therapies that we do around it. So for somebody who's in a car accident, they would benefit, because what a chiropractor is doing is we're looking at not just the pain, what caused the pain. So if there's a whiplash injury, which is actually a muscle strain, so the car gets hit, your body jerks, and the muscles stretch and tear. That's a muscle strain. So as a chiropractor, I'm focusing on not just the pain and inflammation, but let's get the actual muscle to heal. So that's the difference from a pain management perspective, where they're just managing the pain. They want the pain to be lower so that you can go about your business. Yeah. The chiropractor, obviously the pain is secondary, but the primary thing is you have an injury. So we're trying to correct whatever the injury is. So for someone who has an injury, we're identifying the structure that caused the issue. So a muscle strain, if something is dislocated, whatever the injury is, we identify it, and then our course of treatment is dealing primarily with that injury. For an office worker or someone who has, postures that are maybe contributing to their condition, what's even more important than the adjustment is figuring out, okay, what are you doing that's creating this problem? So with men, a lot of times with low back pain, I figure out that they sit on their wallet. So if you have a wallet with like 30 credit cards in it, and it's like 3 inches thick, if you have it in your right pocket, when you sit down, it's imbalancing your pelvis. And so when you do that day in and day out, it creates this imbalance in your body. And just like if a car is out of alignment, one of the tires is going to wear down quickly. Yeah. Same thing with our spine. And so you can come into my office, I can do an adjustment, you can feel great. But if you go back home and you sit on your wallet for 3 or 4 hours at a day, the issue is going to continue to come back. Mm-hmm. And so what's just as important, I think, as the adjustment is finding out, okay, what contributed or what caused this issue that brought you into my office. So if we can address that, then, we can get you better a lot quicker.
Gotcha. So what do you say to people who may fear, chiropractic services? Because when you see it on TV, they show you cracking the back. As you mentioned, your family like to say the crack your neck procedure. Mm-hmm. That can be fearful for some people. Yeah. So how do you prepare people for chiropractic services?
Yeah, that's a good question. So a lot of times we fear the unknown, and it's not just the average person, but I've found other healthcare professionals, even my kids' pediatrician, nurse practitioner, medical doctor, they were just, ignorant to what chiropractors did. And I like that she was open, about it. When she found out I was a chiropractor, she asked a lot of questions. Yeah. But the first thing I do is I just educate them on what it is that chiropractic does, and how I deliver the actual adjustment. So I explain to people what the noise is. I say, just like, if you crack your knuckles, it's not the bones that are making a noise. It's actually air or gas in the joints. So if a joint is misaligned, when I do the adjustment, if there's gas in the joint, then it will make a noise. So I adjust some people, they don't make any noise. I adjust some people, it's like fireworks. So I usually tell people, if they've never had an adjustment before, okay, this is what you can expect. You may hear a release of gas from the joint. We call it a cavitation. I'm not breaking the bone. You don't have to hear it, but if you do hear it, it's perfectly normal. So I think just educating them, letting them know ahead of time, so they know what to expect, really takes away some of the surprise. As to the safety of chiropractic, there are a lot of different techniques. So the main technique that I use, there will be a cavitation, but there's instruments that you can use. There are different types of tables you can use. There is a low force technique that I use for children, which really, if you see me do the adjustment, it really just looks like stretching or, massaging. So it's a lot of different techniques that are catered to the person. So the way I adjust you would not be the same way that I would adjust a baby. One thing I tell people to put their mind at ease, I tell them that every healthcare professional has to have malpractice insurance. And as you could imagine, the rates would be contingent upon the risk with the procedure. So a medical doctor has, a general practitioner has a certain type of malpractice they have to get. A surgeon, obviously, their malpractice is probably going to be a lot more because what they do has more risk. Yeah. Well, on the chiropractic side, my malpractice is $1,000 a year. Some medical doctors or surgeons, their malpractice can get up to 30, 40, whatever, $1,000. So when you look at it in that perspective, the risk, chiropractors, physical therapists, massage therapists, acupuncturists, we're all on the conservative end. So as far as the safety of what we do, as far as morbidity and people dying, the rates are way lower compared to the more invasive procedures. I mean, you have people that die from taking their prescription medications as prescribed. Mm-hmm. People dying from Advil, and especially, oxycodone, that's the big thing. Yeah, these opioids, people are dying from taking them as prescribed, so obviously the malpractice rates will be a lot higher. So when I put it in that perspective, people are like, oh yeah, you're right. They're really skeptical, which is understandable, about something they don't know, like chiropractic. But when I say, well, have you ever had a prescription? Have you ever read all those side effects? And you know all the things you can do. It puts their mind a little bit at ease. Yeah.
So I'm glad you mentioned that as well. But I do want to touch on some of the proactive things that people can do before they get to the point of needing chiropractic services. As I mentioned, me and my wife, we get massages at least once a month. Even if we're not feeling any pain, we go get it. And it's not just the gentle touch massage. It's like deep massages that focus on specific areas, stretch massages. If I've been running a lot that week, getting a stretch massage. So are those some proactive things that we can do before coming to a chiropractic, or should you still, see a chiropractic on a daily basis?
Very, very good question. And I think as a society, we're so used to pain management where it's like, okay, I'm only going to go to the doctor if I'm in pain or if something is wrong. And what I think people are looking more towards now is wellness or preventive treatments. The best thing I can compare it to is dentistry, and they've done a great job with prevention. So even if you don't have cavities, most people go to the dentist twice a year, at least, to get their teeth cleaned, to prevent cavities, to prevent gingivitis, to prevent, tooth decay. And I let people know the same thing about chiropractic, because a lot of people are like, okay, if I don't have pain, would I need to come? Is it appropriate for me to come? And I say, at the very least, you would go to a chiropractor the same frequency that you would go to a dentist. So you come in, I check your spine. If there are some misalignments, I do the adjustment. Why would I do it if you don't have pain? To prevent degenerative changes, to prevent arthritis, to prevent disc bulges, to reduce your chance of injury. So it's a preventive measure. And it's so hard to sell that, in the Black community. But I think we're more open now to preventive techniques, especially because, we're seeing that a lot of people, our family members, are dying from stuff that is, considered lifestyle diseases, cardiovascular disease, heart attacks. All these things can be preventable from a healthy lifestyle. So when people, start to get on the bandwagon of, okay, I want to be healthy for me because I want to live a long time, then they will start to consider things like chiropractic. So the average person does come into my office because they have a pain complaint, which doesn't bother me, car accident, whatever. And so I just explain it to them, because there's this myth that people think, once you go to a chiropractor, I heard you have to go forever. And I'm like, no, you don't have to. I'm going to be honest with you and tell you I would like for you to be a lifetime patient, because I know that chiropractic helps to build your overall wellness. But if that's not a goal that you don't want to have, that's fine. But then I turn around and say, well, if you go to the dentist and they say you don't have any cavities, you don't go back ever. Like you continue to go because it's a preventive lifestyle. So when people do come in for injuries, I treat them accordingly. So if we keep mentioning the car accident or somebody fell at work or whatever, in the beginning, they come in more frequently. That's considered an acute injury. So usually they would start off at 2 or 3 times a week. Once they start getting better, we reduce the frequency. And now that the pain is down, we're working on, okay, let's rebuild the muscles back to how they were pre-accident or pre-fall or pre-injury. And then once they're out of pain, then we transition them to wellness care. And most people with wellness care, they're once a month, every other month. I may see them once or twice a year, but it's really dependent on their activity level. So a warehouse worker who's lifting boxes, they probably need to be coming, every month, maybe twice a month. Someone who has, a job that's not as demanding, they can stretch it out a little bit further. So everybody is different, and your starting point is based on how you feel when you come in, but you certainly don't have to have a quote unquote condition, or a pain or some type of ailment to begin. And you certainly don't need one to continue with chiropractic care.
So you just mentioned that you recommend that people, not just come one time, but continue to come as a preventative care for them. Do you recommend other activities for them to do? Because we talk about chiropractic services being holistically healthy. Do you recommend other activities for them to do, like yoga or getting in the swimming pool and doing water aerobics or swimming laps? Are there other things that people can do along with coming to see you as well?
Yes. So I touch on some of those things when someone first comes into my office. So I'm educating them every visit. I mean, people don't know about chiropractic like they do other professions. So I think the education point is very important. So I do hit every aspect in the beginning. And then as we get more towards wellness care, I emphasize the importance. Again, I'm a great chiropractor. I do a great adjustment. But if you're doing something at home that's counter to what we're doing in the office, obviously it needs to be addressed. So we talk about nutrition. Even though chiropractic focuses on the physical body, I've realized a lot of people heal slower, or it takes them longer to get better because there are other things we haven't addressed. Spirituality, if there's a lot of emotional stress that's going on. I'm not the professional to deal with it, but we can identify it as, okay, this is something that's hindering your physical healing. So let's address these emotional things. Nutritionally, what are what type of supplements are you having? What type of habits, eating habits do you have? Are you drinking enough water? Are you being hydrated? You would be surprised at how many people, just don't drink water at all. In the winter, if you're not I see you got your water bottle. I left mine. But even something simple like drinking more water to lubricate the joints. I've seen people go beyond, what we thought they could, just, from small things. So we do address those things as they come up. Physical activity. A lot of my older patients, who maybe have knee pain, they can't do a lot of stuff, a lot of weight bearing activity. So, I recommend they get in the pool, do some water aerobics. Yoga is great just for relaxation and breathing, but also flexibility. So I have somebody with back pain, and a lot of times it's because of other things. Lack of flexibility in the hips, things with the knee, things with the, with the feet, the arches in the foot. And so I found that stuff like yoga and just other physical activity really can enhance the chiropractic adjustment. So a lot of times these things go hand in hand.
Yeah. I keep mentioning my wife, but my wife is a certified yoga teacher.
Nice.
So she does yoga all the time, and she tries to get me to do it. I do it sometimes, not as much as I should. It's a little too slow paced for me, but I know the benefits are great, so I need to really do it more. But you mentioned something. You said a lot of people really don't know the benefits of chiropractic services. You don't hear it as much. Why do you think that is? Because, just listening to you sounds like it can have major benefits to your life if you just come twice a year, 3 times a year, just to get an adjustment, just to check you out. Why don't you think, doctors mention it to you as much, or, you don't see as much advertisement about chiropractic services? I see more advertisement about massages than chiropractic services, but chiropractic services sounds like it's more beneficial to you because it adjusts your alignment, works out the muscles, works with your spine, your posture. So just your opinion, why don't you think people put out in the world, you should go see a chiropractor?
Well, I think it's a few reasons. One is I think that chiropractic as a profession is not broadcasted. Money, I think, is one thing. There are certain areas, and especially in the Atlanta area, there's a lot of a certain type of chiropractic. So there are the practices that are personal injury. And it's kind of like, those practices are run like a meal. Get them in, get them out, get a check, And that's perfectly okay for those types of practices, but I think it does us a disservice, especially in minority communities, when we see, all of the health conditions that we have, and we're not offering, a better solution. When it comes to commercials and advertising, I mean, you have to have money in that. So when you look at TV, of course, you see all of the drugs that they have. Ask your doctor if, XYZ is right for you. And, there are certain companies, pharmaceutical companies, they have all of this money, so they're able to push it out. And so it's become a normal thing. And I would be frustrated as a medical doctor when I've gone to all of this school and then, I have my patient coming in telling me, I think this is what I want. This is the dose that So I think money is part of it, but then also chiropractors aren't all on the same page. So you will see some practices that are wellness practices that are preaching about how chiropractic can help overall with your health. But then you have some chiropractors that are like, just come to me if you've been in an accident, or just come to me if you have pain. They're more on the short term. So I think if we can get all the chiropractors on the same page with the same message, and it's like, look, we can help a lot of people in our community, if we got on the same page. It would really have to be a coming together and, of our resources to get something like that. Yeah. But on the other end, I think that medical doctors don't really refer it to their patients as an alternative, is they just don't know about chiropractic. I believe in medical school, they may have one class on like alternative medicine, and who knows, I gotta, I know a couple people who are medical doctors, and they ask me, what I would think would be simple questions, and it just goes to show they just don't know. Like I was mentioning earlier, my kid's pediatrician, one of the nurse practitioners, when I told her I adjusted my son, she was like, so what do you crack his neck? And I'm like, no.
That's the perception.
Yeah, so this is somebody with, advanced degrees, and she had no idea. So it prompted me to do a video. I did my son's first adjustment. It's maybe like a 12-minute video where I'm explaining what I'm doing, why I'm doing, like why would a child or a newborn even need an adjustment? So I just went into the detail. And his nurse practitioner was like, that was so informative. I'm going to show my coworkers. So I just think a lot of it is they just don't know. And going back to, the opioid crisis, why wouldn't we try to find a safer alternative for people as opposed to them getting hooked on pain pills? It's like, hello, chiropractic, we're here, but we just collectively have to get that message out so people understand. So the basis of chiropractic, like why is it beneficial for your health? So your brain controls everything in your body. It's the computer. Yeah. So you have the brain, you have the spinal cord, which is in the middle, and then you have nerves at every level of your neck and back. And those nerves basically control everything in your body. Your heart, your lungs, your kidneys, your muscles. I mean, everything is controlled by the nervous system. Yeah. And so chiropractic, we're concerned with structure and function. So structure would be the spine, which is what protects the spinal cord. And then function would be the brain and the nervous system. The chiropractic adjustment is meant to correct any misalignments in the spine. So the idea is that if there's a misalignment in any of the joints in your spine, any of the vertebrae, it can potentially rub or pinch on the nerves that come out at that level. So if that nerve goes to the muscles in your leg and that nerve is being pinched, it may cause, muscle spasms or like some muscle twitching. If it's the nerve that goes to your uterus or ovaries, it could cause excessive cramping. If it goes to your lungs, it could cause symptoms. So a lot of symptoms people have that they wouldn't think go to a chiropractor to see. There is a connection with the nervous system. And so the idea behind a chiropractic adjustment, if I can find those restrictions in your spine and correct those, it will allow your body to function at 100%. So just like a straw, if you're trying to drink out of it, but it's pinched, you're not going to be able to drink anything. So the same thing with the nervous system. If you have some nerves that are being pinched, it's not going to have 100% flow to whatever organ it's going to. And that could potentially show up as some type of symptom or a deficit or bring about some type of injury or, health condition. So that's the whole idea behind chiropractic. Structure, function. Is there anything in the structure or the spine that's interfering with the nervous system? If so, we want to correct it to restore health.
Yeah. See, I feel like the knowledge you just gave me right now, I feel like everything you explained would validate it even more for chiropractors to work hand in hand with the medical doctor. Like you mentioned, instead of giving opioids to someone for pain management, why not recommend some type of chiropractic therapy to someone like you to see if that's an alternative? Try that out for a few weeks, a few months before you even go to the opioid. That should be the last resort.
Right.
Let's talk about the expenses of coming to see someone like you. Is it expensive, or have you started seeing a lot of people who work have it built into their insurance plan? Should this be something that people look out when they sign up for medical benefits, to look out in their insurance plan to be able to come to see someone like you?
So that's a good question, because money can be a barrier to people getting health care. What a lot of people don't know, chiropractic is covered by pretty much every type of insurance. Most plans have maybe 20 visits a year. And if there is a situation where people need more than 20, usually we can submit, like not necessarily an appeal, but we can submit, what's going on with the patient, send in paperwork, more or additional visits can be approved. So a lot of the plans I see include at least 20 visits a year. Medicare, they're a little different. It's 12 a year. And so, I can verify anybody's benefits. So if you have health insurance, you bring your card, I can call and check to see what benefits you have. But like I said, most do cover chiropractic. I'm even starting to see plans that are covering massage therapy now. The only plan I can think of that does not cover chiropractic is Medicaid. Okay. So the different types of insurances that are a part of Medicaid, they do not cover chiropractic in the state of Georgia. There are other states where Medicaid does cover chiropractic. And I think eventually at some point it will be covered in Georgia. Again, it's just a great alternative, or at least a great starting point for some people before they have to advance to the more invasive procedures. And obviously, if somebody can avoid a $50,000 surgery, with chiropractic, and most people, their copay is $25, $35, $45 to see me. Now, people who do not have insurance, I know in my office, I have affordable rates. Each chiropractic office obviously is independently owned, so everybody sets their own prices. But I've seen a big shift away from insurance. It's a lot of work. We submit all this paperwork. If we put a comma where there's supposed to be a period, they'll deny it. You have to figure it out. You have to resubmit. You pretty much have to have a full-time staff just to handle, billing and insurance. So, and this is not just for chiropractors, but all across the board. A lot of providers are going out of network and deciding that they don't want to deal with the hassle of insurance, and they make their rates affordable where, even if I don't accept your insurance, you won't have to sell your house to come for a visit. So that's one thing I can say about chiropractic, but I'm starting to see it across the board that it's more affordable, and, especially if the providers are going out of network. But personally, I'm in network. I do accept insurance. If you don't have insurance, I do have, affordable rates so that people can get the help that they need.
Good. So as we're starting to wind down, I do want to touch on your specific business, because you recently just opened up your new office. So I definitely want you to tell people about, the different services that you may offer specifically, any promotions you have going on, any events you have coming up in the new year. Just talk a little bit about your office in general.
Yes. So in my office, I do the chiropractic adjustment. We do other therapies for people who have muscular injuries. So again, your athletes, your average person who just, started back working out, especially we're getting to the new year. People are doing more than they did before. So We have therapies. I do soft tissue therapies. Similar to massage, it's an instrument-assisted soft tissue mobilization technique. Kinesio tape, which I know a lot of people were introduced to that during the Olympics. They would see the athletes like with the different color tape on their legs, their arms. So I provide that in my office. Nutritional, I have like a weight loss program. I do anti-inflammatory programs, which I think are really good for people who just have chronic pain. They found that a lot of chronic issues are because there's a lot of inflammation in the body. Our diets, sugar, a lot of sugar. A lot of those things can contribute and prolong how long we deal with certain issues. So in my office, we try to address some of those things. Another cool thing I do in my office is something called regenerative medicine. Okay. And that's an alternative for two main groups of people. Athletes who have acute injuries, tendinitis or, some type of soft tissue injury. The regenerative medicine treatments that we do helps to speed up the healing process so they can get back on the field as quick as possible, which we know is, important for athletes. Yeah. The other group that benefits from regenerative medicine are chronic. So we talked about acute injuries, but now the chronic injuries, conditions like arthritis. Maybe someone has a lot of arthritis in their knee. They've gotten the steroid injections, which help temporarily and actually eat away at the joint even more. Someone who's on the road to maybe getting a knee replacement and wants to avoid it at all costs. Regenerative medicine actually helps to regrow some of the cartilage in the joints. Can prolong, or not even prolong, but can sometimes eliminate the need for having to get surgeries. So it's a really cool therapy that we have in our office. We've been doing it for about a year, but for the new year, we're going to be ramping up, doing some specials for people who need that. So, with chiropractic, I love the preventive side, because if I can prevent you from getting arthritis, it's going to make you so much more healthy. But, obviously I get some people who are further down the road, 50s, 60s, 70s. They're just being introduced to chiropractic care. There's nothing I can do to reverse those degenerative changes. Yeah. Adjustments can slow the progression or stop the progression, but we can't go back in time. So if you have a 60-year-old knee, I can't give you a 20-year-old knee. And so regenerative medicine allows me to kind of turn back the hands of time. And so I like it because it's natural, and it's with the paradigm of chiropractic. It's a holistic type thing. It works with your body as opposed to working against it. So that's a pretty cool new thing that we have in the office, and we're going to be doing some specials for the new year. I would recommend, if anybody wanted to get some information, they could go to my website, which is www.rtoga.com, and that's the abbreviation for Regenerative Therapy of Georgia. I also post a lot of educational videos on my Facebook page, which is Regenerative Therapy of Georgia. It has some demonstrations of chiropractic adjustments. It talks about the regenerative medicine. So any questions you would have, a lot of that, you could find the answers, And the location is, I'm technically in Stonecrest. This is Stonecrest now. But if you put Stonecrest in, it just reverts to Decatur. So the address is 5036 Snapfinger Woods Drive in Decatur. But again, it's technically Stonecrest now. So
that's crazy, it's Stonecrest now. So I got another question for you. Because you talked about regenerative medicine. And I think it's crazy the advancement in that technology has had on athletes, everyday people, the medical field. I mean, you look at some of these athletes, I'll speak specifically about football players who may tear their ACL. Previously, that took probably about a year to 2 years to heal. Now you have people coming back in 6 months, 9 months from an ACL injury. And then you talked about the practice that you're doing, the regenerative practice. What's your view on how technology has really had an impact on the medical field, but on your specific industry as well?
I mean, the medical advances, it's been so much that has happened just in the last 10, 20, 30 years. regenerative medicine has largely been coined like stem cell therapy. There's more to it than that, but that's usually what people, how they identify it. But I've known some, professional athletes who actually were getting what they call the stem cell injections while they were, still playing, and it was able to buy them, more time. Obviously, with surgery, you have a certain amount of time for recovery, you have rehab, and it can be a long, drawn-out period. So for somebody like an athlete whose season is only a few months, getting back to the field to play quickly, is important, and it could be the difference between, getting your full salary or not. And so it has been a big thing with professional athletes for a while. So it's new for us, but you speak to someone who's been a professional athlete, they're probably already familiar with regenerative medicine. Regenerative medicine has actually been used in surgery rooms. One of the simpler treatments is PRP, which is platelet-rich plasma, and it's actually derived from your own blood. So they draw your blood, they put it in a machine that spins it, it separates the components, and so your plasma has certain proteins in it that, have the ability to help with healing.
Is that the Kobe Bryant surgery? The surgery he had, I think Kobe Bryant flew over to London to get that surgery when he messed up his knee, like right before he retired.
Well, I'm not sure what he had going on, but he has actually had some regenerative medicine procedures. So I don't know if he got the stem cells, the PRP, but cardiac surgeons, after an open heart surgery, they would put the PRP to help with healing the wound. A lot of eye doctors have actually used regenerative medicine and PRP. So it's been there, but I think we're just now to a point where it's being offered to the public as an alternative. And I mentioned, the cortisone injections, which have been shown to have a lot of bad side effects. My husband, for example, got one in his knee, got about 6 months relief the first time. Second and third time, no relief. Well, what it did is it reduced the inflammation to help with the pain, but it didn't really do anything to correct what was causing the pain to begin with. So, whenever you do something that takes the pain away, it allows you to continue to use the body part, but you're doing more damage. So the cortisone injections in themselves actually eat away at the joint, so it's making the condition progress even more. And so regenerative medicine is giving the same pain relief, but instead of causing more damage, it's rebuilding and regenerating things. So the fact that it's more mainstream now and people are able to have access to it is a great thing. One of the limitations is it's not covered by insurance yet. But I think just people having the education that it's there and talking to their doctors about it, hey, is this an option? Just having that out there, I think, is opening people's eyes up so that they can consider, some of the alternatives that are out there.
Wow. So you have a wealth of knowledge in this industry, a lot of knowledge about this industry. For people who want to know just more about the industry, I know you mentioned your Facebook page posts a lot about things in the industry and news in the industry. Are there any other resources either on the internet or different events that come around the Atlanta area that people can attend that you may know about?
So again, there's not really a wide-scale educational thing about chiropractic, but a lot of chiropractors locally have different types of seminars and workshops in their offices. So in my office, we're going to be doing weekly workshops talking either about chiropractic and the benefits that it has, or the regenerative medicine. And a few of my colleagues, another Southwest DeKalb alum, Dr. Utley, I know he has like a weekly talk about chiropractic. So it's not just for the patients or practice members, but they can invite friends and family members. And really that's the best way I know to get the word out. Just each one teach one. And, when people are educated and they get good results and they're feeling better and just overall they can see an improvement in their health, they refer a friend or, they tell somebody else and they come and get the information. So there's not any big scale, events, but locally, a lot of chiropractors are just taking the reins and getting out into the communities I do career days at, schools. I'll go to people's churches. I've been on some health panels. I will go to jobs and do workplace ergonomic type, how to improve your posture, reduce stress at work. So a lot of chiropractors, because we want to get the word out, we're willing to go out and do different events just to educate people. Health fairs, doing screenings, checking people's spines. So we're there. Yeah. We're out there. We just, we just have to be get in the right places and get in front of the right people to spread the message.
Yeah. Y'all, she's letting you all know she is there. She's out there.
I'm available.
She's available. Y'all, this is very, very important. I appreciate her taking out her time to talk to us about this information. Because like I said, I don't really know as much as I should. And I was an athlete. And I can probably count on my hand the number of times that someone has even mentioned chiropractic services to me if I was in pain or if I had muscle tightness or something. People really don't mention you should go see a chiropractor. So I appreciate you taking out the time to explain this to us, give us the benefits of it, give us the preventative side of it, what we can do to take care of ourselves before we even come see you. Very, very informational. So if you are listening, please visit her Facebook page. Please visit her website. Reach out to her. Her office is in Decatur, well, technically Stonecrest. Reach out to her. She has a beautiful office in the Southwest DeKalb community. So if you're listening and you're from Southwest DeKalb, please come support your alumni because she knows a lot about this industry. So as we close, you all always know I like to mention this from Nipsey Hussle because I love Nipsey Hussle and his music and what he represented. He told y'all the marathon continues. It does not stop by any means. So whatever you do, let's take it to the next level. Let's elevate to the next level. This is a way, as I mentioned before, that I'm trying to take our health to the next level. So we focus a lot about food and on exercise, but let's start talking about the other things that impact our health, like finances, being social with people, stress relief, meditation, yoga, stretching, just everything that we come in contact with in life. Let's find a way to see how it impacts our life and how we can elevate it to the next level. So I appreciate you all listening. Once again, please visit LaKendra's Facebook. Please visit her website. Reach out to her. Come by and visit her. And until next time, peace.